Dear audience, I've got the pleasure now to give you the next talk on students contribute to patient-centeredness, lessons learned from the Witten Herdecke Clinic Education Award. First, I want to introduce you to our educational concept, since our concept is slightly different from other interprofessional clinical education awards. We also combine education and care, and we also have a focus on interprofessional learning. However, we offer this specifically to medical students, and our focus is on student participation. So if you look on the traditional way to integrate students in healthcare teams, the student is often integrated as an observer. That means that we have a team of professionals, of nurses, therapists, and physicians who take care of the patient. The student is not really relevant for the system. He or she is shadowing the physician, and in some aspects, they have contact to the patient. For example, they draw blood or they're taking the history. The student's role remains passive, the tasks are artificial, and the teaching means additional work for the physicians and healthcare professionals. In summary, the students helps mainly the healthcare team in their practice. At the clinic education wards, we changed the role from the students with that of the physician. That means the student is the primary contact person for the patient as well as for other team members. And the physician is now shadowing the student and supervising him or her. And only if the physician realizes that the student is not able to solve the problem, they are intervening. So the student's role is active. The tasks are work-based, and the teaching is part of the supervision. In summary, it's not only so that the students help the healthcare team in their practice, but the student is supported to realize his or her practice. How do we realize this? We have now 3 clinical education awards, one in internal medicine, one in neurology and pediatrics. Each student there is responsible for 2 to 4 patients at a time. We have 4 to 5 students every time in internal medicine and 2 in neurology and pediatrics. Students have all tasks of a junior house officer. Students are actively involved in the development and further development of the clinical education awards. And we are practicing integrative medicine by complementing conventional medicine with anthroposophic medicine, meaning that students are not only giving the usual treatment, but also natural remedies, and they are also ordering art therapies like music therapy and painting therapy. And we have also focused on biographic counseling to foster personal growth of patients. We started in 2007 with the first clinical education awards in internal medicine, and in 2012 we developed the ones in neurology and pediatrics. And we have educated now 280 students since 2007. So we had to look for care as well as for education. Regarding care, the students are integrated as primary contact person for patients and with an authentic team integration with the rights and responsibilities of the staff member. And very important, also with an adequate supervision. Looking for the educational side of our CEW, we developed 2 weeks of intensive interprofessional introduction where students learn how to collaborate with the different related professions. We installed clinical reasoning seminars as well as teaching rounds, as well as integrative patient educational conferences and clinical reflection training, where Gabriele Lutz is talking about later on. So we combined active participation with learning by reflection. The question now was, what was the impact of such a concept on learning? And also, what is the impact on healthcare? So let's first look for the impact on learning as experienced by students. Working and learning at the clinic education was experienced as a stress. The stress came from being responsible. Wondering whether something went wrong, whether I did something wrong, was a definite stress. Students also realized that they have support to tackle the stress. The guided reflection was a wonderful thing. It felt good because one could reflect the clinical work and create a scope for development. Both things, the stress of being responsible and the support for surviving, helped the students to be activated and to learn. I learned that the patient's treatment is only as good as I am. This ended up making me feel more motivated and also increased my learning, making it more intensive and effective. So we saw a transformation here from a learner without any responsibilities to a professional who contributes to patient care. Now the question was for us, what was the impact on patient care? We did not expect so much impact on it because every medical decision was still be done in accordance with a supervising physician. However, we did not know how patients would react to the fact that students would be their primary contact person. So we surveyed 80 patients from 2009 to 2015 who were treated in our clinic education wards. And as you can see here, the problem frequency reported by patients of control group 2, which is a nationwide control group, the same specialty in hospitals, that 13% of patients reporting problems regarding overall care, compared to 10% of the control group 1 patients of the same department at our hospital without students, and compared to only 6% of the clinic education ward. The better result regarding the overall care was not due to the experienced treatment success, which was similar in all 3 groups, but to the patient-physician interaction, which were much better at our clinical education wards as compared to other 2 groups. And this had a significant impact on the recommendation rate, which was much higher in the clinic education wards than in both other control groups. This was really astonishing for us and a critical point for transforming our view on the role of students, because it's not so easy to reduce the problems of the recommendation rate from 8 to 3%. So the question was, which specific value can students add to our healthcare system? Usually, we look for students mainly as beginners and learners, and then they cannot add anything. However, if we realize what they can do at our clinical education ward, there are several aspects. First of all, students ask questions. They explore the patient and the process of healthcare, and they may induce reflections in patient and team. Students are close to the patient. They have time and are motivated, and they may bridge the worlds between the patient and the professionals. They look with a naive view, try to see the whole picture, and they can integrate specialized perspectives. They bring in their creativity, their specific individual skills and competencies, and they enrich the competencies of the team. They gather information from a related place and from the World Wide Web. They can foster the knowledge generation of the team. And they bring in their motivation, their idealism, and they're open to the future. They induce reflections on our values. So all in all, summarizing these aspects, we would say that integrating students as co-creative partners can induce transformative learning towards patient-centered healthcare. I now want to contextualize these results and experiences into a picture. So the traditional way of looking at students is that students are learners with a peripheral participation in our healthcare team without any impact on healthcare. But as I told in the introductory talk, due to the Lancet Commission, our problems have changed. They are more complex. We have super specialization, and we have more commercialism. All these aspects leads to the fact that students are not anymore part of our healthcare community. The role of students is marginalized, and there's no meaningful apprenticeship experiences, as Michael Witten, a former editor of the Academic Medicine, stated. So we have two challenges. One is the educational challenge, to find a meaningful role for students. The second one is to find someone who navigates the patient through the complex healthcare system and to individualize all the different possibilities to patient needs. We have explored at our clinical education ward what happens if we integrate students with an autonomous relationship to patient and team. And what we realized that this activates the patient and promotes patient-centeredness. So if you're looking at learning, we can say the traditional system students are integrated as learners. We have a community of practice and learning by teaching. In the possible future clinical education, we can integrate students as contributors and transfer our community of practice to become a community of learning, and to transform learning by teaching to learning by co-creation. Thank you very much, and these are some of our publications and other related publications on that topic.